Hello, everyone, and thank you for joining today's webinar on post-pandemic ECD transitions addressing disparities in policies and programs for young children. I'm Evelyn Santiago, and I'm the Executive Director of the ARNEC Secretariat. Before we begin this webinar, allow me to just mention some house rules and reminders. So the webinar will be recorded and all the presentations will be made available on the ARNEC's website. If you want to ask questions to our presenters, please use the Q&A feature located in your Zoom meeting control, which is at the bottom of your screen. You can also vote a question by clicking on the thumbs up button. Please join as ARNEC's member and follow us on Facebook for you to be able to get regular updates on what's happening on ECD in the region. At the end of the webinar, you will be directed to a short survey which we request you to accomplish so we can have your feedback on this webinar. Next slide, please. Our lead discussant for today's webinar is Dr. Sheldon Schaefer. Dr. Sheldon is the current chair of the ARNEC Board of Directors. He also served as the chief of UNICEF's Global Education Program in New York from 1998 to 2001. Thereafter, he became the director of UNESCO's Asia Pacific Regional Bureau for Education in Bangkok, Thailand from 2001 to 2008. Sheldon will be moderating the first half of the webinar session. Please welcome Dr. Sheldon Schaefer.
Thank you very much. I'm very happy to be here. I want to congratulate Evelyn and the rest of the Secretariat for the wonderful job done in terms of preparing this last webinar of the first series of webinars dealing with COVID. Save the Children came out last week with an estimate that there are 10 million children in the world will not re-enroll in school when schools reopen. I think that probably doesn't cover early childhood development programs. We know that the rate of immunization for children against childhood diseases is going drastically down. We know, in fact, that many ECD programs have closed. They're funded by communities and parents, and hundreds of millions of parents are going down, or many teachers have been lost from the profession because they've not been able to be paid. So why this seminar? Next, please. Next, please. Yes, why this seminar? Well, most of the discourse to date around COVID-19 has focused on what we're doing now, what countries are doing now, such as online education, and the logistics of reopening, when and how and who. In my point of view, it's now necessary, even more so, to address explicitly inclusion and equity in ECD, so that disparities which existed before the pandemic are not exacerbated because of the pandemic. Next, please. We have to ensure that recent ECD gains, enrollment, new programs, workforce capacity are not lost because of the pandemic. ECD enrollment has been going up slowly, faster in some parts of the world over the last decade. There is the real possibility that this enrollment increase is going to go down backwards to where we were 10, 15 years ago. New programs created, new access made available, newly trained workforce, all will likely be lost. Much of it will be lost perhaps because of the pandemic. The seminar wants to talk about increasing support for the ECD sector and ECD programs. If you look at the different subsectors of education, it's likely that ECD will suffer the most. Teachers have jobs more or less guaranteed in the formal school system, grade 1, etc. Teachers in the ECD sector usually don't. And so therefore, the ECD sector is the most fragile and will take longest to recover after any kind of new normal is reached. And finally, we have to shift the focus of discourse, in other words, to maintaining and enhancing access to and the quality of ECD services and early learning. I hope we don't talk in this seminar only about current responses or mechanics of opening schools. I hope that we talk about maintaining, enhancing access to quality services with a special focus on those who have ordinarily been excluded and will likely become even more excluded because of the pandemic. Next slide, please. So the key questions are these. What are the plans, approaches, and strategies for reopening preschools and ECD centers? This we can talk about. Most discourse talks about reopening primary schools, formal education, but the reopening of preschools and ECD centers probably even more difficult in many ways. How have the disparities and vulnerabilities faced by disadvantaged and marginalized young children before COVID-19 likely increased as a result of both the pandemic and the containment and mitigation measures enforced by governments? Children with disabilities already were disadvantaged, unable to access any special care they might have received in their early childhood development programs for 3 or 4 months. They will become even more vulnerable because of the pandemic and because of the containment measures of the governments. So what can be done to identify such children and assess the nature and extent of their increased vulnerability? How do we find those children who were already vulnerable, disadvantaged, whose vulnerability has increased compared to their luckier peers? And finally, question 4, what actions are being taken or can be taken to mitigate these increased disparities? They are happening, they will happen. Governments must therefore address the needs of such children to ensure that they are not left further behind. If we only talk about how to get everything back to normal when schools reopen, we will completely ignore the fact that many children will have been reversed in their development from the old normal, will have gone backward, and we have to worry about how to catch them up. All right, with that, I'd now like to introduce the keynote address. His Excellency Dr. Han Chuan Naron, an old friend of mine, an old colleague for many years, has been the Ministry of Education, Youth and Sport in Cambodia since September 2013. He's also chairman of the National Committee for Early Childhood Education and Development, a very important post that often ministers of education do not assume. He holds a master's and PhD degrees, international economics from Moscow, but also has degrees in international law, economics, and public education administration in France and in Thailand. He's worked in various diplomatic missions and research centers and institutions as a political and economic analyst. He was also secretary of the Ministry of Economy and Finance from 2004 to 2010. Some people claim that's why he's been able to get so much more money into the education sector as Minister of Education, because of his friends back in the Ministry of Economy. And finally, he's been an author also of a number of government policy papers and books on Cambodian economy, public finance, international law, and education. A true, I think, Renaissance man in our midst. So please, Your Excellency.
Thank you, Dr. Sheldon. Dr. Sheldon, distinguished participants, ladies and gentlemen. Allow me to thank ARNEC for organizing this webinar to enable us to share experiences on how to address disparity in policy and program for young children. As you know, the COVID-19 pandemic has a huge impact on our young children, but more significantly on the most vulnerable and marginalized families and communities. Current discussions are mostly focused on basic education. Therefore, we should lift discussion on the short and long-term impact of the pandemic on early childhood, especially young children, and address the disparities that might have been worsened by COVID. We all need to further reprioritize our education policies and budget to increase investment on ECE. UNESCO estimates that about 1.5 billion learners are affected by COVID pandemic, arising from unprecedented closure of school and ECE centers and the stay-at-home directive mandated by most governments to halt the spread of the virus. According to the results of ARNEC rapid survey, COVID is having a significant impact on the nurturing care of young children. On the health front, not only are the young children facing risk of COVID infection, but they also have difficulty in accessing basic healthcare services and experience disruption in accessing childhood care services and experience disruption in immunization program and other health services. On the learning front, learning routines for young children have been disrupted by the pandemic. While some children have shifted to online learning mode, many others from disadvantaged background are unable to access the online learning due to lack of internet connectivity or technological equipment or support. Of course, they need the parental support for learning. Young children from marginalized families and communities disproportionately bear the brunt of COVID. The negative impacts on young children are further compounded by poverty, migrant status, poor living conditions, disability, and special needs, and other factors such as gender, location, ethnicity, religion, and language. Parents are feeling significant stress and having difficulty coping. The top factor contributing to level of stress experienced by the family in the Asia-Pacific region are work stoppage, loss of income, ECD centers closure, prolonged homestay, disrupted routine, and higher childcare burden at home. The significant impact of COVID threatens the progress on ECD targets in SDG in the region, which adversely affects young children who have already been at a disadvantage even before the pandemic, as mentioned by Dr. Sheldon. In the Asia-Pacific region, they may include the following: children with delays and disabilities, children living in poverty and those living in rural area and remote community, children of refugees and migrants, and children of ethnic and linguistic minority. As you know, COVID has a big impact. I think people who are infected by COVID, I think those, especially including in the developed country, are those who living in a fragile environment. As countries draw up their COVID response and recovery plans, there is a need to ensure that governments, with support from the private sector and NGO, put ECD at the center of these response and recovery plans, and that increasing needs of vulnerable young children are addressed, so that the ECD gains in recent years are not lost, and that ECD programs are supported even more to achieve SDG target. In general overviews, the CMO member countries are facing similar problems, but having the same point of view that young learners ought to be well taken care of during the pandemic. Online learning has been one of alternative breakthrough in learning, which can be preserved until the new normal phase. Parents' involvement in nurturing and guiding the children is essential during online and home-based learning, as they are first teacher indeed. Care for both physical and psychological well-being of children is a must. I think that education after COVID will not be the same. We must continue to be vigilant and continue to work together to share experiences in order to continue education for our children. For example, many ECD schools introduce bubble approach, as Cambodia also opened the school in August for the first phase of the school with higher safety condition. Young children cannot practice social distancing. That's why many schools introduce bubble approach. But how can this work? How can we mitigate the risk and reduce the risk for the parents as also for our young children? So we need to debate and to find way to address that problem. In this regard, I would like to call on governments in the region to give priority attention to, firstly, identifying learners whose exclusion and vulnerability have increased with disabilities, poor, ethnic minority. Have we done enough to do our community mapping and profiling so that we can target pockets of vulnerability. Putting in place transformation policy and action to address COVID reinforced disparity, to ensure that all ECD programs reopen and that teachers are retained, to get all children, especially girls, back to the ECD program and schools, to provide extra help to children with disability, to ensure that children in remote locations without access to online learning are not disadvantaged even more. School can be partially reopened to cater the vulnerable children by following the suitable protocol during pandemic. We could consider to send the hard copy material of learning directly to parents' home to overcome the internet and electricity issue. Indeed, parental education continue to be the priority. TV and radio broadcasting could be developed, not only rely on national channel, but also collaborating with the private channel to ensure wider reachability. Engaging the private sector, including NGO, in responding to the needs of most marginalized groups as countries slowly transition to the new normal. Indeed, Cambodia has partnered with NGO, for example, CARE, to provide the radio program to the children of ethnic minority in 2 provinces, because we need to provide also multiple language, that is the language of the ethnic minority, to teach those children early childhood education. Indeed, blended learning will continue because we cannot reopen the school immediately. We need to combine both face-to-face and also the e-learning. But how to ensure equity? Because children from rural area would not have the equipment to ensure e-learning. Therefore, we need to be innovative, I think, in ECD, and we need to combine different learning platforms, including radio, TV, e-learning, but also traditional distance learning, such as paper-based learning platform, and also small group of students to be present in the school, because we need to reduce the class size in order to ensure that the young learner would be protected. Indeed, we need to balance between protection and education. I think without that, we cannot ensure the well-being, physical well-being, and also psychological well-being of our children and also of the parents. Thank you for the opportunity to talk, and wish you good health and stay safe. And thank you for sharing the ideas. As we open up, we must learn from each other to ensure the protection of our children, to ensure the continued learning, and to ensure that the gains from the recent years in ECE can be maintained, but especially to ensure that the budget and investment continue to increase for the ECE, especially to ensure the safety and the proper sanitation of preschool. Thank you.
Thank you very much. That was very useful, as I've long known. I appreciate very much, one, you keeping to time, which you've been able to do, but also to present so many useful ideas and arguments. I just have a bit of time to ask you a few questions before we move on to other country presentations.
Yes.
There is a lot of debate going around in different countries as to reopening of schools and to whom are schools reopened first. Some countries choose upper grades, some stagger grades, some choose early grades. From your perspective, and given your long support of early childhood, how and when will the early childhood development centers start? Will they wait longer, or will they be given priority?
Actually, we start with the school they are ready. It means that, you know, we have, for example, 10,000 of school. So, but not all the schools are ready to have the social distancing. So the approach that we are taken is we divide the school into 3 phases. For the first phase, we will open in August. So we allow other country to go first, and we can learn from the experience. So when for the small group of school that have higher standard of sanitation, that they can maintain the social distancing, we allow for early childhood and also all the grade from K1 to 12 to reopen. And we signed with them an agreement, MOU, with the SOP, with the health protocol that they are required to implement. So the parent can send the children to school, but if they are not satisfied, if they are not yet, happy, the school should provide e-learning to them. So the parental education continue hand in hand with the face-to-face and also with online. For the first batch of school, both early childhood and also general education, primary and secondary, can go ahead. Now we are moving to discussing the second phase. For the second phase, we would allow schools with middle condition, that is middle standard, that can go ahead, but they should reduce the class size, and we call it online plus. That is, they should combine online education and also face-to-face. For the early childhood, some of the schools introduce a bubble. What is a bubble? Bubble is that they allow small group of students to learn together, in a class, maybe 10, 15 people. But they don't allow them to mix with other group. But we control the parents very well. The parents should cooperate with the school. Whenever they have meeting outside of the school that can have effect on the early child on the school, they should inform the school for protection. Parent cooperation is very important. And for the second phase, we also allow both early childhood center to operate, but they are required to maintain that the standard, meaning that. And the third phase is for all other schools with minimum health standard. It means that the selection is based on the readiness of the school. The school should be ready before they reopen, and the cooperation of the parent very important.
That to me is a very creative way of doing things. When you look at other countries, there are some saying, oh, we'll open the higher grades first and open early childhood 4 months later, or begin at some other point. And of course, what you've laid out, your mechanism that you've laid out, is a very good way of trying to ensure that children who are vulnerable in early childhood development centers have the opportunity to regain some of that they have lost in the meantime. So you're making that possible by that mechanism. So thank you for that. One other question is you've been a strong supporter of ECD. The funding is not always available as you might want it to have, but at least you've been trying. What can be done, do you think, post-COVID in terms of financing and in terms of how the ECD subsector might look differently? Not that this is an opportunity for something necessarily positive, but it is an opportunity for change, and it perhaps is an opportunity to try to argue for more funding. What do you think about that?
Yeah. So the government reduced budget cut across the board. But for our ministry, yes, we will have budget cut for education, but we cut programs like seminar, like field visit, but we protect the operating budget for ECD and also maintain the investment for ECD. So early childhood education subsector will not be affected by the cut. So even though we have budget cut, but we have to prioritize what we should cut. So the program that are not, urgent, we will have budget cut and implement it later on. But for the ECD program, we will maintain that. We cut only some budget for seminar, field visit, something like that, but maintain the core program, salary and operation of the ECD center. And of course, we will increase the budget for online education, for distance learning. Also, we will increase budget for health and sanitation for the schools across the board.
Just maybe one more quick question. You talked about kind of work that might be done in schools and communities to identify some kind of profile of children coming back. What would be the tools that you would have to be able to measure the extent of enhanced vulnerability, enhanced disparities that you might find? How do you at the school level try to identify children who've fallen backwards compared to their peers?
So basically we focus on the ID pool program. So we, based on the socioeconomic survey, we identify 4 poor households, and the poor household would benefit from, we create ID for them, so they can benefit from social protection budget. That is the poor household. We get some allowances from the government, and also the poor household will have some, for example, scholarship program, and also some meal for the school. So in this regard, by using the socioeconomic survey as a tool, and then we use the ID pool program to identify the communities, and then we will target the school in that area. So we use geographical targeting to address that problem and identify vulnerabilities.
No, that's very important. There is the other issue that we might get to later about for the individual child, to identify a child with disabilities who is farther behind his abled peers, or a child studying in a mother tongue who has not had the benefit of that for 4 or 5 months compared to his peers who've studied in the national language. So the tools available per child to understand how they might have fallen farther behind, it's also, I think, something that you're already looking at.
Yes, indeed. In the provinces and the district with ethnic minority, I think we have a bilingual school and preschool that, we can use the existing mechanism, because they live in some area of Cambodia. And we have the multilingual school that we can use to address that problem. As to, children with disability, we have a special education department, and also a special education institute with a network of colleges and schools that help with specialists to identify different disabilities of the kids.
Well, thank you very much. I have to say just a few more things before we move on to the second session. Just to say that I've been on a lot of webinars about COVID impact on education and early childhood development, and you, Your Excellency, are on most of them. I think you are the busiest webinar minister that I've seen, and I think it's testimony to how seriously you take the issue that you're actually taking part in this kind of webinar. So thank you very much.
Yeah, thank you very much. We have to learn in order, to get useful idea, new idea, so that we can respond to the needs of our children. And I think that field visit also helped me to learn more from the community, from the school, and to bring it to the policy level, and also to roll it out as a program to address the need. I think it's a big challenge, and it's not just short term, but it's long-term impact on our children. So thank you very much for sharing the idea and the opportunity. And also this cooperation also help us to improve our policy and to convince to get more budget. You know, you talk about how to increase budget to education. And I think the way to increase budget is to show performance and also to how we respond to the COVID as well. And I think that, you know, these new ideas should give us, you know, some of the opportunity to properly respond to meet the needs and also to continue to maintain the budget for education. Thank you, Dr. Sheffield.
Thank you. I just want to maybe summarize a few points before we move on to the second session. One is clearly from the discussion we've just had, the importance of seeing that how many challenges and disparities that are found among children at a young age, which have existed for a long time, are going to be exacerbated, increased, enhanced as a result of COVID. They're not getting the care they had in early childhood development centers, the special care, issues around social interaction, issues around health and nutrition, feeding programs. There are all kinds of things that children disadvantaged who got out of ECD programs have not had, and therefore they will go back into those programs further disadvantaged. I think the other point about the trying to rally governments around the idea of, and this relates to the budget, of what has to be done in a sector like ECD to achieve even more successfully the SDG target around ECD. Governments are going to be struggling with all of the SDGs in education, I think. Yes. And I think the argument is going to have to be necessary to make that it's important to prioritize funding, yes, to achieve SDG 4.2 as a necessary foundation for achievement of other targets elsewhere. I think I'll stop there. There are more presentations later on, Mr. Minister, from other countries. If you and your colleagues can join, I'm sure that there would be even more lessons to be shared. So I'll turn this back now to Evelyn.
Thank you. Thank you. Otherwise.
Thank you.
Thank you, Sheldon, and thank you once again to His Excellency, Dr. Hangchun Naron, for giving a very inspirational talk and sharing, you know, his insights. Yeah. Okay, thank you. And we are now on the second half of our webinar session. And our moderator for this second half would be Professor Margaret Sims, who is the Honorary Professor of Early Childhood at Macquarie University in Sydney, Australia. Her research in recent years has focused around the professionalization of early childhood and the impact of neoliberalism on education. Margaret is also a member of the ARNEC Steering Committee. Thank you once again, Margaret, for agreeing to moderate this webinar, and over to you.
Okay, thanks, Evelyn, and thank you, everybody. We've got a number of presenters that we want to get through, and I'm going to be quite rigorous in terms of trying to keep time. I have a 1-minute reminder, and I will put the alarm on my phone for each of the presenters to tell you when your time is actually up. So we're going to do 4 presentations first, and then there'll be some time for questions, and then we'll follow with another 3 presentations and then some more time for questions after those. So what I'll do is I'll introduce the first 4 speakers in one go. And our first speaker is Maki Hayashikawa, and she's the Chief of the Section for Inclusive Quality Education. She's the Regional Coordinator for the SDG for Education 2030 and the Gender Focal Point. Maki has nearly 25 years of development work experience, mostly working in the Asia Pacific region with UNESCO, UNICEF, and the Japan International Cooperation Agency. So Maki will go first. Following her will be Teresa Inchong. And Teresa has over 40 years of outstanding performance as a leading educator in the Philippines. She's currently operating as Vice Chairperson and Executive Director of the Early Childhood Care and Development Council. Her leadership has yielded the establishment of national child development centers in more than 730 cities and municipalities of the Philippines. And Dr. In Chong was awarded the 2017 Outstanding Professional in the Field of Education by the Philippine Professional Regulatory Commission. Our third speaker is Muhammad Hasbi, and he is serving as the Director of Childcare in the Ministry of Education and Culture in Indonesia. He completed his PhD in Public Administration at the University of Makassar in Sulawesi, and he served as the chairman of the informal and non-formal childcare organization in his hometown, and also the Ministry of Education and Culture Research and Development Unit on ECD and Community Education in the West Java region. And our final speaker of the first four is Yento Yu, who is the Deputy Secretary General of the China Development Research Foundation. Previously, he was at the Johns Hopkins Nanjing Center at Peking University and had been a visiting fellow at both Oxford and Harvard Kennedy Schools. So welcome to our first four speakers, and I'll ask Maki to lead off, please. And Maki, on my schedule, you're given 5 minutes.
Okay, I hope my screen is there. Thank you very much, Margaret, for the introduction. I have been asked to give a quick regional overview on the impact of COVID-19 and something that, oh, okay, start my video now. So I hope my video is now starting. Just to give a little bit of a context to the following presentations, but I think the minister had already also given us a quite good overview already, even from the perspective of Cambodia. So apologies for some of the audiences and also our co-panelists that some of the information may actually be a repetition, but I think it's always good to remind us ourselves the kind of impact the COVID-19 has had on the ECC fact sector and also still having impact. So far, over 93 million pre-primary students or learners in 34 countries in the Asia-Pacific region have been affected by, left out of school and have not been reached. Over 4.4 million pre-primary teachers in 24 countries, which is like 85% of them are women, have been affected by the COVID, by school closures and also losing jobs and also insecurity there. The digital divide has oftentimes, meant that ECC was not really a priority, especially given the infrastructure availability for early childhood centers and also at family level, that many early childhood provisions have not been able to continue simply because of the infrastructure technology unavailability. And also based on a survey that we had with the ECC workforce earlier this year, that many ECC workforce have been affected directly by the insecurity with their job status and incomes and also their support professionally as well. But also, most importantly, I think the COVID-19 has affected the early childhood care sector, particularly because of the social distancing now required. And this would also have implication of school reopening, which I would actually refer to later on in this presentation. Now, this is just a recap of the survey that UNESCO, UNICEF, ARNEC, and also ESA, ECWY conducted earlier this year in April to understand the situation of the ECE workforce. And of course, among the many things that has been revealed by the survey, I think one of the important points, which has to be also looked after in the coming month, is that teachers in early childhood were really not prepared, or neither were they supported to be able to cope with the COVID-19 situation and to be able to continue teaching and learning either remotely or even in a phased manner in the classrooms. And also generally most teachers were not really received, had not really received any training on crisis and disaster management in general. So the least teaching skills, but also on crisis management as such. Now, of course, as we know and look around in the region, many countries are now gradually reopening their schools, which is actually a positive thing. They have started to reopen school, and as of end of June, about 25 countries in our Asia-Pacific region have actually reopened schools either fully or partly, and many more are likely to follow suit in the coming month. This is just a chart from a survey that UNESCO, UNICEF, World Bank conducted actually in May, asking countries of their plans for reopening schools. And you will see here that I think that there was a question from Sheldon earlier, that what would be the status of early childhood pre-primary schools? And you will see where it says like do not know. The pre-primary education tends to be the sector, where governments don't seem to have much clear plan in May whether they would actually be opening or not. Now, in anticipation of countries to reopen, reopening schools, UNESCO, UNICEF, World Food Program, and World Bank issued a joint global framework to support countries on their reopening schools. This was really in response to the urgent need to reopen healthy and safe schools for all learners based on an assessment of the benefits and risks and guided by the best interest of the child. The guideline was aimed to inform the decision-making process regarding school reopening, to support national preparations and guide the implementation process as part of also a public health and education planning processes. Unfortunately, this framework did not really specifically make reference to pre-primary ECC level, which is a bit of a big oversight. But the principle should apply to all levels of education. Hence, it is worth referring to this framework when countries plan to reopen their early childhood centers and pre-primary school as much as possible. Because the framework itself suggests 6 key dimensions, which are presented here, to be used to assess the state of readiness and informing planning, such as policy, financing, safe operations, learning, reaching the most marginalized, well-being, and protection. So we've been talking about a lot on how to make sure that equity and inclusion is ensured while reopening of schools happen at the early childhood level. Now, policy consideration, financial requirements together create the enabling environment that is needed to support each of these dimensions. But of course, contextualization adaptation will be critical so that the local needs will be appropriately responded to, and especially when in a context when there are multiple deprivations, such as densely populated areas or low water settings or conflict areas or post-disaster areas. These will have to be taken into account when the framework is applied in each country context. Now, clearly, if we look specifically at the ECC sector, there are several challenges that ECC centers and pre-primary education schools are likely to face. And one clearly is infrastructure preparedness, whether the environment can secure health and sanitary measures as children will come back to the classrooms. Second will be the preparedness of teaching staff. And we have heard from the surveys and other presentations that many teachers have also suffered from psychosocial and emotional trauma and pressure. And there's a need to make sure that our teaching staff are well prepared and supported to come back to the teaching scene. Then, of course, pedagogical preparedness, including the pedagogical processes to assess the progress during the school closures, how much the learning loss have happened, and how to organize remedial classes, especially for young children at the early childhood pre-primary education level, when the loss of learning at pre-primary would affect negatively on their smooth transition into primary education later on. And of course, we shouldn't forget about the students themselves, but also the family and society preparedness, whether there is enough awareness and willingness to return to school and ability to continue learning. As we heard earlier, that there could be a pretty large number of children who may not be actually coming back to school if no measures are taken to support them. Now, I just want to conclude by referring back to our SDG for 4.2 on early childhood, and where can we actually reach this target now with this post-COVID situation. This is just a quick reminder of the 5 indicators under 4.2 in early childhood, 2 global one and 3 thematic indicators. And we are currently undertaking a 5-year progress review of the SDG 4, and already even prior to COVID-19, in our region, many countries were already off track to meet SDG 4.2. So here we have the latest situation. For example, only 7 out of 15 countries we stayed available. More than 85% of children were developing on track, which means the rest of the countries are not developmentally on track. What is also very concerning right now is that like 4.2.3 on average, less than 70% of children under 5 have positive and stimulating home learning environment. Now, this will be more critically affected for children who are from rural areas and poorest families. They are less likely to be exposed to any kind of learning activities and a stimulating learning environment. And this is likely and expected to be further deteriorated for some families in very remote and vulnerable situations. The message is that we are yet not clear on how much impact the COVID-19 will have on the SDG 4.2 progress. But it is very clear that, without doing much, putting much more effort and investment on ECC, we will not really able to achieve 4.2 in the coming, the remaining 10 years that we have before achieving the entire SDG 4 targets. And we have to really consider the fact that COVID has really widened the equity gap, and especially the impact has been heavy on most disadvantaged families and children. And so the priority would have to be on that, the most vulnerable and vulnerable marginalized population as well. And just to finish off, last week, UNESCO organized a global webinar under the patronage of Her Royal Highness Princess Laurentienne of the Netherlands. And it was very, it was quite striking for the Princess Laurentienne to say that early childhood development has always been a blind spot in our pre-COVID societies, and the pandemic has shown how vulnerable young children are. And she asked why ECC has been forgotten child in our societies, and we should not be failing our young children anymore in the coming years. Thank you very much.
Okay, thank you, Maki. Can we move straight on into Dr. Teresa Inchong, please? Teresa, you have 7 minutes.
Okay. Good afternoon, everybody. This is the situation of the Philippines in the post-pandemic ECD transition, addressing the disparity in policies. So amidst the difficulties and challenges posed by the pandemic, the SCCD Council is committed to ensure the provision of continued early childhood education to children aged 0 to 4. So the Council started with 2 advisories. The first advisory is ensuring that the teachers and the workers are tasked to do community mapping, to profile their children, to assess their children, to request for disinfection and sanitation of their facilities, and to conduct survey and parents consultation. Advisory number 2 is actually ensuring that all children aged 0 to 4, most especially those belonging to vulnerable sectors, are provided access to quality program in time of COVID. And therefore, we started with we started to give guidelines on the implementation of alternative modes of learning delivery, and we also use home visitation, and we engage the parents as our learning coach at home. The impact of COVID, the pandemic has affected millions of Filipinos, just like in other countries in the region. Aside from the effects of quarantine, which include loss of job of the family breadwinner, absence of means of transportation, and absence of job, we have also identified as one of those that affect ECCD's inability to access educational services. For those with disability, there is an inability to access habilitation and rehabilitation and general health education. The research conducted by the CWC the respondents said that they should be provided with wider access to essential services during emergency, which include provision of essential goods and financial assistance, supporting home-based intervention capacity, and building of parents, because by this time the parents are the teachers of their children at home, and of course ensuring access to essential services, including transportation. To further identify disadvantaged and marginalized children and assess the nature and extent of their increased vulnerability, community mapping and profiling of children aged 0 to 4 are identified as requisite tasks to child development teachers and workers prior to start of the class, and also to tailored fit the intervention for children from children 0 to 4. So one of the action points that we did is to push for the establishment of the national ECD M&E systems, where more comprehensive collection of data in health, nutrition, and early learning and social services are done by respective agencies, ensuring that data collected are disaggregated and vulnerable children are identified. We have a project for M&E, and this is supported by the UNICEF. And this system will ensure that the member of the council are able to access the data in one portal, and that they are able to determine which one has weaknesses and which one can be replicated. Our response to COVID, we identified 4 items. First, inclusion. And then number 2 is mental health and psychosocial support and child protection. And number 3 is stakeholder engagement and coordination and monitoring and evaluation. Early education must be accessible for all groups of learners, including vulnerable children. Some of the planned action are contextualization of specific materials by child developing teachers and workers, such as manipulative toys, dolls, for children with disabilities, indigenous and other marginalized and vulnerable groups, especially those in GIDA area, which is geographically isolated and disadvantaged area. The earlier we include the children with disability in the center, the better if it is for them, because an early intervention is already an early start of inclusion. So now our teachers are trained on supporting children with disability remotely. They provide support to caregivers of children with disabilities, including those with developmental or intellectual disabilities, in implementing specific consideration with managing care and education for their children at home and their own mental health and psychosocial well-being. The next is the mental health and psychosocial support services. We put emphasis to this, not only for our children and parents, but also for our child development teacher and worker, because they also needed something that is very important to them. We consider e-counseling, telephone hotlines, and parents and caregiver, so that the teachers and parents may be able to access assistance. The other one is we have developed key messages as referenced by all stakeholders. As such, we continue airing the Radio Bulilit or Kids Radio to be able to help parents who needed help in their children at home. And of course, we also coordinate with key agencies and stakeholders to provide targeted intervention to vulnerable sectors. And this is very important. The monitoring and evaluation is also something that we focus on, because it gathers information on the implementation of alternative mode of learning delivery, and therefore this is a research-based. We ensure that the data of children collected follow ethical consideration, and these data are used by the local government to give a tailored fit intervention. And parents or caregiver should play a big role in documenting the development of their child, because they are the learning coach in their at home. I'm done. Thank you very much.
Perfect timing, Teresa. Well done indeed. That's a hard road to do all that in that time. Okay, our third speaker is Mohammed Hasbi. Mohammed, can I hand over to you, please?
Thank you. Good afternoon, everyone. My name is Muhammad Hasbi, Director of Early Childhood Education, Ministry of Education and Culture. It is my pleasure to present the case of Indonesia in addressing disparities in policies and programs for young children at the time of post-pandemic ECE transitions. COVID-19 occurred in Indonesia since March and continues spreading to whole nation, that reached to more than 88,000 positive cases. Particularly for the cases of 0 to 5 years old children, the percentage is 2.3%, or nearly reached 2,000 cases, which resulted on 41 death cases. The risk of death in children is much more higher for vulnerable ones. For example, for those children who live in malnourished situation. Specifically for the childhood students, COVID-19 affected around 6.8 million ECE students, which come from 13 million parents, 442,000 ECE teachers, and 203,000 schools. Since then, majority of ECE centers are closing down, which supported by the policy of learning from home. It is estimated about 30 million children under 5 are at higher risk becoming malnourished. Because of the restriction since March to June 2020, the children have difficult access to primary health services and no growth monitoring for the young children. The national survey on 2018 found that 1.5 million children aged 0 to 4 not living with their mother and father due to various reasons, mostly due to migrant worker. Even though young children live with their parents, the caregiver might not have adequate parenting skills to support their growth and development. And dealing in this COVID situation, adding more stress to caregiver, which potentially affecting young children. Those facts surely increase the risk of living condition of children during COVID-19 pandemic. As for children with disability, many support needed to this group. Currently, many non-government organizations helping the government to address issues in this group of children. This slide describes how the government of Indonesia worked collaboratively in response to COVID-19 and in mitigating the risk of all children, including marginalized and vulnerable children and family. The intervention classified into 3 main targets. The first is to increase understanding and prevention of COVID-19 case. In this, the government used existing mechanism in developing some new movement and initiative. The second intervention focused to reduce the vulnerability. As an example, under the Ministry of Social Affairs, as I mentioned earlier, there are increasing funds to support family of young children, including pregnant mother from low socio-economic background. Another example is the Ministry of Education and Culture Policy and Program, which will be discussed further in next few slides. The third intervention is focused to provide psychosocial service for mental health. This is a new initiative and using existing service to address violence against children and women. In early of July, the Ministry of Health reopened primary and basic health services in community-based service. We call it Posyandu, and sub-district health posts with health protocol to provide immunization and growth monitoring for under 5 years old children. The health facility working closely with the community worker, volunteer, the Posyandu cadre to provide services for children immunization and growth monitoring. The funding for vulnerable family from the Ministry of Social Affairs is also increased 25%, and it is targeting to marginalized and for poor family with conditions such as a pregnant mother and family of young children. The funding used to be distributed 3 times a year, and since now until December 2020, it is distributed monthly. In Indonesia, every village are entitled to manage their own funds, which called the village funds. It is about 67 to 135,000 US dollar per year per village per year. Local communities are able to utilize 20 to 30% of their village funds to implement COVID-19 response activities, as well as to support poor families in their communities. So aside from national funds and program, the COVID response is also empowered by its community-based initiative than can be supported by the village funds. Some community use the fund to provide foods for the poor, in addition to improve the sanitation and hygiene condition. The government of Indonesia take action to ensure education for young children in place during pandemic time. In general, there are two government actions in education system to address COVID-19, in which also aiming to address the challenge in inequity and disparities. The first action is regulation on educational process during COVID-19 pandemic. The second action is coming from Ministry of Education and Culture regulation and program to support teacher, family, parents and children in our nation. Next. ECE teachers are very much affected during the pandemic. They are not well equipped to support children learning from home. In regard to support teacher, Ministry of Education and Culture provide online and offline training services. While to support teacher in difficult to access area in remote rural area in Indonesia, the Ministry of Education and Culture work with various organizations such as ECE Teacher Association at the district level to conduct offline training, which targeted nearly 5,000 teachers. Aside from the training, Ministry of Education and Culture also provided pocket books that consist of 12 different topics that can be used by teacher as well as parents to improve the learning from home process. To help parents of young children, Ministry of Education and Culture established online seminar with various topics for parents, in addition to develop several learning materials such as storybook, parenting books, and digital learning materials using audio-visual media, for example, video and infographic. Yeah. As mentioned earlier, Ministry of Education and Culture policy in COVID-19 response include flexibility of educational funding. In Indonesia, we have the education data system where every school registered in the system are entitled to receive government funding that is about $41 per children per year. Before COVID-19 pandemic, there was restricted in using the funding to support teacher or teacher assistant honorarium. But now the schools can use it for any purposes that support learning from home and improvement to the facility to meet health protocol standard as well as to support teacher initiative. Ladies and gentlemen, so that was my presentation. Thank you very much. Hope we all have a good day. Thank you.
Thank you, Dr. Muhammad. And our final presentation in this group of 4 is Shinto Yu. Shinto, can I ask you to put your video on and sound, and let's hear your presentation, please.
Dear Dr. Schaefer, ladies and gentlemen, good afternoon. I'm Shinto Yu from China Development and Research Foundation. CDRF is committed to develop ECD programs in poor rural areas, as well as carrying out evidence-based policy research for the central government. So China is the first country affected by the virus. Though situation here now has been largely under control, the virus is still spreading all over the world, and we have to prepare for the potential second wave before a vaccine being successfully developed and widely used. So it might be too early to say post-pandemic. So it is very important and timely to share our ways to protect our children. On behalf of CDRF and our Vice Chairman, Mr. Lu Mai, I really appreciate ARNEC's great efforts in organizing this important meeting. So in China and other society as well, there are at least 4 main negative effects of the pandemic on children's development. First, disruption of in-person education and intervention. The pandemic has hampered students' learning as schools and ECD centers were temporarily shut down. CDRF's home visiting and our One Village, One Preschool program in rural area has also been suspended. Second, declined investment in children. What is worse, the livelihoods and food supply of the poor was disproportionately influenced by economic slowdown, leading to a dramatic reduce of investment on children, and actually including the food supply and also access to medical service. The third is a domestic violence problem. Home-based quarantine also increase the risk of family stress, which may lead to domestic violence and children abuse. Fourth is a mental health problem. Fear and anxiety about a new disease and a sudden change of living environment was proven to be psychologically and emotionally challenging for children. So what the Chinese government and my foundation we have done, I just want to introduce very briefly. First, put people's lives first and provide sufficient support for protection and recovery. In China, the central government took a very strong leadership in coordinating local governments, enterprises, and civil societies to prevent and control the COVID-19 by locking down high-risk areas and mobilizing resources and medical teams nationwide, and also provide economic support, financial support to local government. However, children, teachers, and home visitors in underdeveloped countries were short of medical supplies. So my foundation, we also launched the rural aid program. By the end of March, nearly 600,000 pieces of protective supplies to our pilot counties. The second issue is about differentiated control were conducted to balance the fight against the virus and the economic recovery. So schools reopening has been flexibly arranged according to the level of risk. For example, home visits in Xinjiang pilot was restart in April, but our ECD center remained closed. So it depends on the situation. And also, thanks to the advanced ICT infrastructure and popularization of smartphones, digital technologies has been widely used to track potential virus carriers and boost online education. So as for children's education, the Ministry of Education of China implemented the disrupted classes, undisrupted learning actions during the crisis period. So free electronic textbooks and many other education services has been provided across the country, significantly reducing the risks of infection and the cost of education. So CDRF also used online classroom to launch a series of flipped training, collaborated with well-known experts in neuroscience, public health, and early childhood education to train home visitors and preschool teachers. Fourth is to establish effective communications platform with timely sharing of accurate information on pandemic to promote trust and cooperation from society. And fifth, actively carry out international cooperation in the fight against the pandemic with information sharing. So we are already facing the worst recession since World War II. The challenge we are now facing is more like a marathon than a sprint. So it is the right time for us to invest in children in our future generation for recovery in the long term. So coronavirus is still continuing to spread across the world. It's hard time for all of us, and we are in the same boat. No country can win the war alone, so we have to work together, and that's why I'm here. Look forward to your wonderful ideas and practices. Thank you.
Yeah.
Well done. We have a couple of questions that I'll go through just briefly, and then we'll move on to the next three presentations. So maybe this question goes to all the panelists, so even if you haven't had a turn to speak yet. there are real questions around the suitability of online learning for very young children, and particularly in the light of the concerns that are around the amount of screen time that children have. So one of the questions that has been asked is, given that we are doing a lot of online learning for young children in this current situation, what are the checks and balances around screen time, and should the focus be, rather than on children, should the focus be on more of a parent education for the parents to do the learning for children? So I'll throw that open to any of the panelists. If you'd like to answer that, jump in. And that's dead silence. Nobody wants to answer it. Who's going to be brave? Teresa.
Yes. Actually, in our case in the Philippines, we focus more on the parents now as learning coach, because the strict health protocol will not allow kids, and even on my own, I would not allow the kids 0 to 4 to go to the center. As such, it's the parents' responsibility to go to the center and meet with the teachers, and they're given materials for the whole week. Then all the other, I mean, particularly if they have no connectivity, it is more on a modular thing. Like I'm thinking of far-flung areas. So these parents are trained how to use the materials, and then including health and sanitation and nutrition. And then they are the learning coach when they go at home. And aside from the child who is 0 to 4, the other kids can profit from what the parents are learn from the center. So I am more on training the parents, engaging them, and not only parents, but the whole family if they could, because children, the very young children, are the most unseen and but most vulnerable. And they are, when their parents are anxious, they're also anxious. So basically, we engage more the parents, the family, I think.
Okay, thank you. Does anyone else want to add anything, or shall we move on to the next question?
Yeah, this is a really good question. And actually, just as Teresa mentioned, it is an opportunity to get parents involved in children's education. But anyway, the technical challenges always exist. So one way to solve such kind of a problem is to keep these videos, class videos can be revisited. So so even there is some information loss, and the children can do it later, and the parents can help, so that we can save more time. Not all of these other problem has been solved in a simultaneously way.
Okay, thank you. Just one other question, and then we'll move on. People are interested in the holistic nature of early childhood development. Obviously, what we want to do when we're reaching out to families is more than just the education element. It's the other elements, the health, the well-being, the nurturing caregiving, all of the safety, all of those things. Would panelists like to comment on how they are using the online platforms and the alternate delivery routes of materials to take that holistic nature of early childhood development into account?
Can I have? Yeah.
Mohammed.
Yeah. Dina will translate it for all of you guys. Di Indonesia, kita memiliki yang namanya program pendidikan pengembangan anak usia dini holistik integratif yang meliputi 5 aspek perkembangan, yaitu gizi, kesehatan, kemudian pendidikan, perlindungan, dan pengasuhan. Nah, sejak lama, jauh sebelum COVID-19, ini telah dikembangkan sejak tahun 2013 dan terus menjadi tulang punggung program PAUD di Indonesia. Terkait dengan isu online learning di Indonesia, dapat saya sampaikan bahwa kita hanya memiliki 13% dari 203.000 satuan pendidikan yang melaksanakan online learning. Selebihnya adalah offline learning yang dilaksanakan oleh guru dengan berbagai media. Jadi isu mengenai online learning di Indonesia tidak begitu signifikan.
No, I don't know how to pronounce your name properly.
You can call me Dina.
Dina.
Yes.
Okay.
I'm happy with the translation. So Dr. Hasbi was explaining that in Indonesia, we have a program called PAUD HI or ECDHI, Holistic Integrative Early Childhood Care and Development, and it consists of 5 programs. Under that, it's nutrition, health, child protections, and then parenting practices, and also early education for young children. So under these programs, even before COVID, we have these programs to help the government make sure that all the 5 components mentioned before is delivered to the children. And in Indonesia, the recent data suggests that only 13% of young children or of the ECD centers using online mechanism, online platform. And so most of it using offline platforms in learning. So what's the government doing, which already mentions in the presentations, the government also supporting using different kind of EIC materials for the parents and also for the teachers. And in that materials, there's also a different kind of topics related to the 5 components of the ECDHI, which I described before. So that's one of the things that been done in Indonesia in regards to holistic and integrated early childhood care development.
Thank you for that.
I saw something that strikes me in the chat box. There is one that says parents are illiterate. I beg to disagree with whoever proposed that. Not all parents are illiterate. In the case of those who are living in the far flanks, if they cannot read, then we do graphic presentation of the materials. We can always help them, but just to put them aside because they cannot read, they cannot write, they know what's good for their kids. So I think I can elaborate more, but there's no more time.
Okay, thank you. Okay. Thank you for that. So, okay, let's move on to the next 3 presentations and then we'll finish off with some questions at the very end. So our next presenter is His Excellency Prakasal, who's the Deputy Secretary General of ECCD and the Director of Early Childhood Education, Department of Ministry of Education, Youth and Sport. And he has been working there for 26 years, including 15 years of experience working in early childhood care and development. He holds double master's degrees, one in education and one in financial planning and another in public laws. Following his presentation, we have one from Mr. Tilashi Thapalaya, who is the Director General, the Centre for Education and Human Resource Development in the Government of Nepal. He got his PhD on educational leadership from Kathmandu University, and he worked as a member of the Strategy and Impact Committee of the Global Partnership for Education, representing developing country partners from the Asia Pacific constituency for the last 3 years. And our final presenter is Mr. Sharab Punchok, who works as the Chief Program Officer of the ECCD and SEN Division of the Ministry of Education in Bhutan. As Chief of this division, he's initiated the development of standards for inclusive education for schools, a 10-year roadmap in special and inclusive education in Bhutan, an examination, assessment, promotion, and transition guidelines for children with disabilities. So if we move straight away into His Excellency Prakasal's presentation. Over to you, sir.
Good afternoon, Excellency, ladies and gentlemen. This is I'm Prakasal from Early Childhood Education Department. First of all, let me thank for ARNEC for hosting the webinar on early childhood care and development in our region. So I would like to share the key point of early childhood education in Cambodia, especially to respond to the COVID-19 for the strategy of continued learning for the early childhood education as well as to another education service. We have a clear instruction issue on how to conduct the continued learning and also e-learning, and also diversification of the continued learning program for early childhood education, including streaming program online, broadcasting through the TV and radio program. And also partnership with the private sector, especially include the learning app with the private sector to roll out of continued learning program, particularly online, and drawing on inter-ministry collaboration and extend continued learning program and broadcasting platform, such as with the Ministry of Information and the creation of the TVK called the TV of Education, and partnership with the education sector development partner to mobilize technical and financial resources to develop and expand continued learning program. This is some of the learning asset that we produce the video content for early childhood education, especially e-lesson product in the video format based on the preschool curriculum framework, focusing with the learning area of preschool, especially for the pre-mathematics, science skill development, and Khmer language development, motor skill development, and also social study development. We are producing for the video episode broadcast by the national TV and the private TV, and also social media page. And also we produce the radio program set to support early childhood education and parenting education. And also we by cooperated with the national radio episode on parenting during COVID-19 in the form of storytelling, and also the collaboration with the provincial radio episode in multilingual education for preschool and grade 1, grade 2, and grade 3 based on the curriculum. And the content of radio program focus on the parental education, including child right and the child right and health care, nutrition, pregnancy, and also social development skill linked to the curriculum, something like that. This is focus on for the parental education and the motor skill development and mathematics, science, domestic violence, and language, and also focus for the ethnic minority children area, something like that. This is we are produced with a radio program. And for the another learning asset, we include a multilingual education radio episode for the preschool and grade 1 to grade 3 students. Based on some area in the country, especially with the ethnic minority area of the family, based on the preschool curriculum, and focus on the grade 1 and grade 2, grade 3 curriculum, multilingual episode development in 3 languages, and broadcast across 2 provinces in our country. Local radio station engage in broadcasting and radio distribute to the students who do not have their own the TV, something like that. The paper based on learning material support to the children learning and data collection to measure the impact going on. Some area of care well-being of children. We are including existing the parental education material to promote care and for the children. By we also develop 34 existing parental education video clip developed previously. We are used in the immediately promote care and protection of the children well-being by including the that I told you in the previous slide for the topic content, including topic the child right, health, nutrition, pregnancy, environment, and hygiene, like that, and also development from for the 0 to 5 years of the children, communication and language development, domestic violence, and the child protection. This is some material that we are collaboration with the collaboration with the development partner, including UNICEF, Save the Children, Pan International, to develop the material, and we share to the some area that supported by development partner. And yeah, and we also have some challenges with our activity, including community concern, like the parent worry about the children. Also have they don't have the TV, also smart TV, something like that. Okay. And for the school safety, I think you are listen for the minister also share you for the 3 phase of the reopening school before we in official opening school. And this is to ensure with the program. So this is my presentation that I'm very quick to share you. Thank you very much.
Okay, thank you. And under time, that's brilliant. Thank you very much. Okay, can we move on to Dr. Tilashi Thapalaya?
Thank you and good afternoon, everybody. This is a great opportunity for me being with you all and then having a presentation from Nepal. Let me share the presentation. It is a very, very brief presentation. As you have asked me to have a presentation, it is structured in exactly in the same line. Only 6 slides I am going to make presentation on these. Let me start the presentation briefly. Thank you very much for this. So this is a post-pandemic ECD transitions addressing disparities in policies and programs for young children in Nepal. So regarding the reopening of ECD centers and preschools in Nepal, the government of Nepal is taking cautious strategy and steps by learning from the experiences of other countries. We have seen that there are countries where they have reopened the schools and ECD centers and then closed again because of some risk involved in it. So we are very much cautious on this. We have so far started some program for learning continuity. That includes some of the use of the printed materials, activity-based learning materials that can be used by the parents or the support, any minimum support from parents or teachers, one. And then radio, local FMs, etc. There are programs for the students as well as programs for targeting to the parents as well. So the programs targeting to the parents also involves some elements about the ECD activity as well, early childhood children's as well. TV programs are there, basically targeting to the children from grade 1 to 10. It is more on the curriculum side, curriculum-based learning material. There are some offline learning materials, learning contents developed that are used in the computer-based learning support system, not very much useful for the early grade children. And there are some programs for the online learning material. So there are programs for the learning continuity, but particularly for the ECD children, they are through parents or through the activity-based learning materials that is made available by the local governments. That is prepared centrally, and then that is made available by the local governments and in coordination with the schools as well. As I mentioned earlier, children below 6 years of age are not encouraged to use online and screen-based programs. They receive the reading materials, activity-based learning materials. Parental education program is also being widely implemented through the radio as well. Reopening ECD centers and preschools. The government has already prepared one school reopening framework. Schools are being closed for more than 3 months now, including the ECD centers. So we have not yet been able to, open these ECD centers and schools, but the framework has already prepared that talks about how the schools or the ECD centers can be restarted again depending upon the risk involved in the particular area, geographical location or the area. So based on the assessment made by the local governments, whether it is safe enough to open the schools and the ECD centers, they can be opened, but then government so far has not given the permission to open the schools as well as ECD centers. It is under discussion, and then as soon as the relevant authority feel that it is safe enough to allow the local government to open the school and ECD centers, we will have the schools open, ECD centers as well. And it also talks about the what and how the schools and the ECD centers can be restarted regarding the security or safety measures that is important to consider, as well as the role of the schools, the parents, and the local governments, and the other levels of the government. Disadvantaged children, particularly not only in the case of the COVID-19, this kind of pandemic situation, even in the general state, the children from the certain segments of the society, whether they are living in the remote area or economically poor from the poor families, their participation in the early childhood education programs is limited compared to the others. So that is very much important. And in this case of pandemic context, the participation is still affected because they are facing very challenging conditions due to the pandemic situation in Nepal, as in the other countries as well. So it is very much similar to other countries. Our government of Nepal is committed to extending basic education, including ECD, PP, to all the children, irrespective of their family background, their location, or any other parameters. Committed to all the children. The Constitution of Nepal 2015 has guaranteed the right to education, healthcare, nurturing, appropriate upbringing, sports, recreation, etc., and personality development, and the rights to early childhood development and child participation to every child. In the same line, the government has already promulgated the Act Free and Compulsory Education Act 2019 that has provisioned for realizing the rights as enshrined in the Constitution of Nepal. Further, the local governments are entrusted to the management of ECD and PPE and taking appropriate measures responding to the needs of the most vulnerable groups of population with necessary support from the federal government or the provincial government. So basically, the main role is with the local government with the support from the, yes. Next, government action to address equity, government mobilizing all necessary supports through the local government units. Even agencies as well are involved in this, NGOs, Ministry of Education, Science and Technology, lead ministry, coordinating the process, providing some incentives. And then NPC, National Planning Commission, in coordination with all the ministries, is providing the support for the ECD. So government is very much committed through the local government for providing the program, and also mobilizing NGOs and CBOs, and also the support from the families in this regard. Thank you very much for this opportunity. So this is very, very brief presentation from Nepal regarding the reopening of schools and ECD centers. Thank you very much.
Thank you very much. Okay, so our last presentation is from Mr. Sharab Punchok. So over to you.
Thank you and good afternoon. I submit my greetings to all the esteemed members who are involved in the presentations on the young, on the post-pandemic, on the ECCD program. So I would like to make a presentation. Thank you very much. In Bhutan, there are different types of ECCD program. So one is the government ECCD program, other one is the private owned ECCD programs, workplace-based ECCD program, and corporation ECCD program, and also the NGOs ECCD program. So ECCD centers closed on 19 March 2020 when the COVID-19 was detected in the country, and it is all important. So with the closure of the ECCD program, 9,422 children were affected. And with that, 948 ECCD facilitators were also affected. And these ECCD facilitators had been providing intervention. And this is, the number is all including government, private, NGOs, and workplace. Then the intervention developed by the Minister of Education. Yes, so the COVID responses intervention. So what the Minister of Education did is the guidelines on the distance learning, developed activity guide based on the education in emergency. And education in emergency is the guidelines prepared by the Minister of Education. So based on that, we prepared the guidelines, ECCD guidelines. Then guidelines on the parenting practices, and these parenting practices were based on the 6 parenting steps shared by the UNICEF and the WHO. So we customized, translated, and shared with the ECCD centers. Then provided support such as hand washing soaps and sanitizers to all the children across the country. And then in our country, there are only 9,400 plus children, so it's easy for us to give. And wherever there are difficulty in getting in contact with the children, then ECCD facilitators made a home visit. And in our country, home visit is very simple because it's near 15 to 20 minutes. That's how it is done. And also the contact is through the social media. So we don't directly contact with the children, but we contact the parents and parents do it. Now reopening. The governments, we wait for the government's directive for the reopening. So in our country, so we have opened the private ECCD centers. And as soon as the government announced that the reopening of ECCD centers, the Ministry of Education developed the guidelines, the protocols of the reopening ECCD centers. Then we also developed a checklist for the reopening. So the private ECCD centers will have to qualify or meet the standards for opening the ECCD centers. That's why. And then we are also planning to reopen staggered. At the moment, the private ECCD centers are open. Now, very soon, we might open the government ECCD centers, and this will be based on the government's directives. Next, Andre. Thank you. And this is the plan the Ministry of Education developed, special in particular my division, the ECCD and Zen division. So what we are going to again do is we will be further supplying the hand washing soap to the children with disability. The ECCD children across the country. We want to again, supply the soap. Then we are also thinking to supply of the home learning materials, kits such as toys, stationeries, and books. And here, JICA, Bhutan JICA is going to support the supply of the storybooks. we had several round of meetings, and then now JICA has agreed to supply the toys and the books to every individual children, and our deadline is on end of this month. So we are expecting the JICA to supply the storybooks, and we also discuss on the supply of toys and stationaries like art, and where the JICA has given us the green signal. And what we have planned is we have planned to continue the family support. The family support is we use the social media. All the ECD facilitators across the country use the social media to meaningfully engage the children. But we have the connectivity problems. But yet, our ECD facilitators are trying their best. Next. And we use 3 W's. Wash your hands, wear masks, and wash your distance. Thank you very much. Margaret, I believe I finished on time. Thank you so much.
You have indeed. Well done. That was a challenge. In the interest of time, although there are lots of really interesting questions I'd like to ask the panelists, what I'll do is I'll just ask one question and then we'll start wrapping things up. And what I want to do is ask a question around disparity. We started the webinar talking about how children who are already disadvantaged are falling further behind during this time of the pandemic. So my question is, what are you doing in your countries to address that difference now? So not just what you're doing for all children, but what are you doing for those who are falling further behind? What are you doing now? And what are your plans for addressing that disparity when preschools, when early childhood development services reopen? So I'll throw that over to you all.
Thank you, Margaret. Do you want me to respond to the
Yes,
questions?
go ahead.
Thank you. Thank you, Professor. That's very interesting questions. And in the country, especially the early childhood are the hardest hit because of the pandemic. And you know very well, it's very difficult even to have online learning. Online learning is not possible. So what we have done here is to, to bridge the gap between the disparity and the rich people. What we do is we make the ECD facilitators to visit with the centers, so home visit. And why we are saying is home visit is because the ECD center in our country is at the heart of the village, and it's 15 to 20 minutes. And we ensure that the ECD facilitators visit and then discuss with the parents. And then if they have a time, then they can also engage the children. So the latest directive, it is available in the education website. So the latest the guideline is we have this kind of guidelines. In the guidelines, we have said that the ECD facilitators should visit at least 1 or twice or 3 times in a week, so that our children are not left behind. So in this way, we are trying to, but the challenges are still there. So we are trying to, mitigate all these challenges.
Thank you. Does anyone else want to address that issue? No? Okay. Well, just very, very quickly, it seems to me that we've had presentations that have covered a whole range of different ways of accessing children, and particularly ideas for accessing children who are disadvantaged. Maybe they're isolated, they're at risk for all sorts, or vulnerable for all sorts of reasons. And that's really useful. You will find the presentations will all be up on the ARNEC website fairly soon, so you'll be able to download them and talk about with your colleagues all the different kinds of answers and suggestions and ideas that have been given to you today. Dr. Thapalea, were you wanting to say something? You've unmuted.
Thank you, Margaret.
Thank you. Thank you very much. Basically, reaching to the children in the remote areas is very, very difficult, as mentioned by the colleague from Bhutan. We also have some provision for bringing the children in the settlement. For example, the teachers or the facilitators, they are mobilized to visit some of the settlements through the local government, but this has not been equally applicable in all the settlements. Some of the local governments have been able to provide or supply the facilitators in the local villages, and then bring the children and then play with them, give some assignments or whatever, and then talk with the parents. So this has been started, but that is not applicable in all the settlements. It is applicable in some of these, and it depends on the activeness or the leadership of the local government, particularly. That has been the case in Nepal.
Okay, right, thank you. All right, well, we are running very, very short of time, so I think it's time that I hand it back to Sheldon. Sheldon, the floor is yours.
Thank you. I'm happy to be back. Thank you very much for all of your presentations. It was a fascinating afternoon so far. Could I have the rest of my slides, please? All right, could you put them all down, I think? We'll go through them quickly. These are insights that we had gained from the earlier versions of the PowerPoints that we'd seen in many cases, and I just wanted to repeat some of the more interesting ones. Each country has a flexible way of reopening preschools and ECD centers, but no specific strategy. Difficult to do that in terms of vulnerable groups. Example from Cambodia, very interesting. You're going to reopen by readiness of schools, ECD up to secondary school, rather than by level of education. That to me makes a lot of sense, but I have heard no one else doing that. So that's something I think to look at. Important to assess the nature and extent of vulnerability, mapping and profiling as planned in the Philippines, very important. Use of radios, low tech, not high tech, low tech, no tech, paper-based learning materials, another example of a flexible approach. Increasing social protection funds for vulnerable groups, pregnant women, families of under 5 children, target support to those that are especially vulnerable, additional targeted support. Strong engagement of the business private sector to try to get a response that's more comprehensive. China, stronger stakeholder engagement in Nepal among many actors to help develop a national strategy that can be the basis for working with targeted programs. Government support to private ECCD facilitators in Bhutan. I think this is very important. What will happen, again, as I mentioned, is that primary school teachers may not have a full salary during the lockdown, but they will have a job to go back to, probably, in government schools at least. ECD programs where you have basically funded by communities and parents will have much less money. They have not been getting salaries often during the pandemic and will likely perhaps not come back into the profession. So government paying salaries of ECD facilitators, I think, is important to keep them on the job. And finally, as the more of a question, as the governments identify these increased disparities and equity challenges, more concrete actions are needed to ensure that targeted policies and programs are developed so that no more children are left behind. What I want to do is just bring back the questions that we had from the beginning of the webinar. Can you do that, please? I want to start by saying that I talked about how this webinar was meant to be different and not be talking about current activities or reopening, but instead to focus on questions 2, 3, and 4. How have the disparities and vulnerabilities faced by marginalized, vulnerable young children increased? Okay. What can be done to identify them and assess this increased vulnerability? What can be taken to mitigate these increased disparities? Okay. There was a lot of very interesting discussion about the context of COVID and the kind of activities that are being done now in terms of learning materials and distance education to handle the challenges of lockdowns. There was some interesting discussion about what's going to happen with reopening of schools, but virtually no discussion about how children who have already been vulnerable before the pandemic, which our ECD programs and subsectors should be focused on, how their vulnerability has increased and how they can therefore be helped after the pandemic is over or schools have reopened to reduce the disparities that had been exacerbated. And I think we have to get our minds around that issue. We're looking at millions of children who are becoming further disadvantaged in relation to their more advantaged peers, urban, elite, wealthy, national language speakers, etc., becoming more disadvantaged as a result of the pandemic, and what our government's going to try to do to make up for that difference. And I think that, to me, is a critical question that the world really has not yet gotten to. Let me just finish up with a few other points. About the ARNEC response strategy. ARNEC has published a response strategy in general about connecting the ECD community in the region through webinars, and that's one of the strategies. Next, please. It is not easy to organize a webinar, as many of you who have done yourselves know. The fact that ARNEC has been able to do so every week or 2 weeks, 8 of them, I think, is especially important, and they have dealt with a number of issues: practical strategies for vulnerable children, caring for caregivers, coping with anxiety, distance learning approaches, security and safety, the power of play, the workforce, and now transitions. All of these are recorded. All of them are on the ARNEC website. If you missed some of them, you can go back and get the presentations and the resources. Next, please. Just at a glance, and I think this is important in terms of what the outreach was: 8 webinars, total of 705 minutes over 12 weeks, so one almost every week and a half, 30 country presentations, largely from this region, 42 speakers, 9 moderators, 3,520 registrants, not counting this one, from the Asia Pacific region, but also actually a large percentage from the rest of the world. Next, please. So thank you for joining us. We found high interest from the region and beyond. It peaked at 812, an average of 500. Good evaluation, and we hope that continues into this website. Very good and excellent. And we think, in fact, very rich practical insights and follow through. We hope this leads to further studies and research, some learning groups, a community of practice or communities of practice that can continue to look in detail at some of these issues about the impact of the pandemic on the ECD subsector, and especially on children who are most vulnerable and disadvantaged, and doing what we can to do to make sure that disadvantage does not grow. So, next, please. Stay tuned for the next webinar series. This is the site of ARNEC. If you haven't joined already as a member, please do so. But please also go to the website to look at all of the different resources, not only from the webinars, but others that should be useful. The response strategy and many others that are looking into the question of the impact of COVID. So, next. Stay tuned for the next webinar series. You'll be hearing about it soon. Thanks a lot to all the presenters and the registrants, and to the ARNEC Secretariat, to Margaret, to Maki, and all the rest who made this such a useful presentation. Goodbye.